Hi everyone, we're walking you through the MLA content map. This video is going to be on musculoskeletal. The first topic is ankylosing spondylitis. This is important. This has shown up in the past. Do the examination of this really well. Know what Schobar's test is, know what makes it positive, what makes it negative. Look at x-rays of this condition and know the management really well. So this can show up in your MCQs, but in your OSCE stations, it's important to know all the investigations and examinations and the management, okay? Next, you have bursitis. Really, any bursa could be inflamed, and you'll have to give the patient advice, give them the diagnosis. So this does tend to show up, so do it well. Next, you have compartment syndrome. This could show up as an emergency case in your OSCE stations. In your MCQ exams, it definitely shows up. I haven't seen it show up as much in OSCE stations, but it could be an emergency case in your OSCE exams. Next, you have crystal arthropathy, and know about gout, okay, and really pseudo-gout and gout. Know the difference. Could show up in your MCQ exams, but your OSCE stations could also have crystal arthropathies. Know the drugs used, know the findings, know the x-ray findings if it is that serious or severe. Yeah, this does tend to show up no matter which exam you're giving, so do it well. Next, you have fibromyalgias. Do that well. Know if there is tenderness or not. Know what kind of history the patient's going to give you. So you should be able to diagnose fibromyalgias, and you should know how to manage them as well. Next, you have idiopathic arthritis. Really, any kind of arthritis could show up. So do all the different arthritis conditions well. Know what the patient could show up with, what kind of complaints the patient is going to have, and how you're going to manage the patient, what kind of painkillers you're going to give the patient, okay? Next, you have inflammatory bowel disease, ulcerative colitis, and Crohn's, right? Important, you should know the difference. They love to test you on this in your multiple choice question exams. It could show up in your OSCE stations as well. Do this topic well, okay? Next, you have lower limb fractures. We've already covered this in previous videos, but just look at x-rays of lower limb fractures. You should be comfortable with identifying x-rays, and you should know what you're going to do, what kind of splint you're going to apply to the lower limb. I haven't seen it show up in your OSCE stations as much, but they could just give you an x-ray in your MCQ stations and ask you if there's a fracture or not, what kind of fracture is present, okay? Next, you have lower limb soft tissue injury. I have seen a station or two in your OSCE exams where the patient has soft tissue injury of the lower limb. Their x-ray doesn't really show anything wrong with the bone, and you have to, give advice to the patient, and you have your classic price in this case. So painkillers, rest, icing, compression, and elevation. Okay, so know about this as well. Next, you have Lyme disease. They love to test you on Lyme disease, migratory joint pains, and in particular, they love to give you target lesions. Okay, so know which areas have Lyme disease as an endemic problem. Okay, and also look at pictures of the cutaneous lesions of Lyme disease, because they may give you a picture, it may be a telephone scenario. So just do Lyme disease well. It does tend to show up in your exams, in your OSCE stations, as well as MCQs. Next, you have metastatic disease. This is a little bit of a non-specific topic, so I guess as you cover all your different topics, all the other topics, this will naturally be covered as well. Next, you have non-accidental injury, very important. Okay, so domestic violence, child abuse, non-accidental injury could be in the case of abuse of the elderly. So just non-accidental injury, know how to identify it, know what the difference between accidental and non-accidental injuries are, and know how to handle these cases. So these usually show up more so in OSCE stations. They do give you some ethical scenarios in your multiple choice questions, or some findings that point towards non-accidental injury in your multiple choice questions. So it could show up there, but in OSCE stations, it's really important you know how to handle such a situation. Next, you have osteoarthritis. Again, like I said, do all the different arthropathies or arthritis conditions. You should know what is specific to osteoarthritis, and just do this well. Tends to show up in exams. Next, you have osteomalacia, right? Know the difference between rickets and osteomalacia. Know all the different investigations you're going to do. Know how you're going to explain it to the patient, okay? So can show up multiple choice questions or OSCE stations, and has shown up in the past. Next, you have osteomyelitis. I think we've covered this as well in previous videos, so you should know how to look at a sequestrum and involucrum, look at the x-ray, know the treatment of osteomyelitis, all the different organisms that could cause osteomyelitis, okay? So yeah, do this well, has shown up in OSCE and multiple choice question exams. Next, you have osteoporosis, important. Make sure you know the normal values of DEXA scan, okay? So what is a normal DEXA scan, what isn't, and how you're going to manage osteoporosis. Again, something that very commonly shows up in your exams. Pathological fractures, again, old age patients maybe, patients with osteoporosis maybe. So any kind of low impact injury leading to a fracture does tend to show up no matter what kind of exam you're giving. So again, important. Next, you have polymyalgia rheumatica. Important, always know that this is related to GCA, so never forget to ask about GCA if you have a patient of PMR in your OSCE stations. Just know how to diagnose this condition, know the associations. Next, you have psoriasis. Again, something that could show up. Pictures, very important. Look at the pictures of psoriasis. Know what it looks like, and also know how to describe it. So sometimes they might not give you pictures, but they may actually describe the lesion in words. So in that case, you should know what psoriasis looks like and what words are used to describe psoriasis, okay, and know the treatment as well. Next, you have radiculopathies. Again, you should know all the different radiculopathies and how they are treated. Does tend to show up in your exams. Next, you have reactive arthritis. What infection could lead to reactive arthritis? Know that. You know you have your STIs and all the associations. And yeah, so do reactive arthritis well as well. Has shown up in the past. Rheumatoid arthritis. I think you know, we all know rheumatoid arthritis is something they could test you on, whether it's multiple choice questions or OSCE. Make sure you look at pictures of rheumatoid arthritis deformities. Know what a Z-neck deformity is. Know what a swan neck deformity is. Okay? Know about ulnar deviation in the case of rheumatoid arthritis. Know all the different drugs they could use. Okay? Very important. Next, you have sarcoidosis. Your non-caseating granulomatous disease. Know about sarcoidosis as well. I haven't seen it show up as much in OSCE stations, but they do like to test you on this in your multiple choice questions. Septic arthritis, just know how to manage the patient, what to do about this, how to identify septic arthritis in particular. It may just be unilateral. The patient will have a fever, swelling, and redness, right? Know how to manage this, know how to take a history, know how to examine this. Next, you have spinal cord compression. Again, now this is an emergency case, so you should know what you're going to do in the case of spinal cord compression and spinal cord injury as well. So know how to assess a patient for this, and just know what you're going to do in these cases. These are emergency cases. Next, you have spinal fracture. Look at x-rays of spinal fractures, okay, and familiarize yourself with that. Next, you have systemic lupus erythematosus, SLE. Know all the different features of SLE, know all the different presentations you could get for SLE. Okay, does tend to show up in your exams. Look at cutaneous lesions, look at pictures of cutaneous lesions in SLE as well. Okay, so yeah, just do this well. They like to test you a lot in your multiple choice questions, but I'm not so sure about OSCEs, but it could definitely show up. Next, you have upper limb fractures. Similar to lower limb fractures, upper limb soft tissue injury, again, similar to lower limb. Make sure you do your shoulder examinations, your elbow joint examinations, all that kind of stuff as well in the upper limb. And yeah, so yeah, just look at x-rays, know when a fracture is present and when a soft tissue injury is present, and what you're going to advise the patient, what you're going to do in those cases, okay? So that's musculoskeletal. A lot of these topics have been covered in other areas as well, so yeah, don't really have to worry about it too much. There are some very important topics in here, so make sure you do those well. Acute joint pain and swelling, you have your arthropathies, you have your septic arthritis, you have your joint injuries, right? Next you have back pain, right? Spinal cord compression, could be bamboo spine, could be a back sprain. They like to test you on back pain a lot in your OSCE stations. Next you have bone pain, you have your osteoporosis, right? Bruising, non-accidental injury. A lot of times you could get bruising and non-accidental injury. Bruises of different ages, right? That is something that's very important in that case. Chronic joint pain and stiffness, again, arthritis, congenital abnormalities, right? Deformities of the bone, deformities, osteogenesis imperfecta is something they could actually give you in this case in multiple choice questions. Eye pain and discomfort, so the association with eye, right? Ankylosing spondylitis could have an association with an eye condition, right? Next you have fever, right, with septic conditions. Limp, of course, lower limb fracture, lower limb injuries, maybe injury of a ligament in the knee, or maybe anything really could lead to a limp in the lower limb. So that's a presentation that you could get. Muscle pain and myalgias, you got your fibromyalgia, you got your PMR, right? Musculoskeletal deformities, right? You could get those. Make sure you do Charcot-Marie-Tooth disease or Duchenne muscular dystrophy, Becker's muscular dystrophy, the differences between all those conditions, how you're going to identify those conditions. You have your neck pain and stiffness, right? Your cervical radiculopathies, right? Cervical radiculopathies, whiplash injuries and whatnot. Next, you have your red eye. Again, something that could show up as an eye condition in ankylosing spondylitis, or with an association with some other condition. Next, you have soft tissue injury. We've talked about that. And trauma. Trauma could definitely show up in musculoskeletal conditions. So yeah, do this well. These stations do tend to show up in either one of your exams. There's a lot of high yield stuff here. So yeah, see you in the next video. Hope this helped.